Hello, this is Michelle Mould, psychotherapist, and I was going to do part two of grief and loss next for my YouTube video channel, but I decided to change my mind because many of us are waiting to have the vaccination for the coronavirus, and I thought it might be more useful to look at needle phobia in case that's something that affects you and you're worried about. And bearing in mind that, there are 10 million people in the UK that have a phobia of some kind. The most common phobias are agoraphobia and social phobia. But of course, there are many different phobias, and the fear of needles and injections is just one of those. But it does affect 1 in 10 of us. So that's quite a big number of us that might be worrying about having the injection. And some of the things that are important to remember is that fear means that our fight and flight has been activated, that fight and flight survival system that we all have. And that means that adrenaline is pumping around our body. It means that our breathing rate increases. The body is trying to take in a lot of oxygen to get oxygen into the blood to reach the muscles. So in a way, what we end up doing is hyperventilating because we are breathing in and taking in longer in-breaths. And of course, we also get all those other symptoms that go along with the fight and flight system. And that can include feeling nauseous, feeling knots in the stomach, butterflies in the stomach. This is because the digestion is shut down. It's not a necessary function in a survival situation, so therefore it's shut down. We can also find that we become dizzy, and this is because this front part of the brain, which is the prefrontal cortex, which is where all of the executive functions happen, things like planning, choice making, decision making, choices, strategizing, that kind of thing. It's not a necessary thing for our survival. For our survival, we just need to run or fight. So therefore, that part of the brain isn't receiving the supplies of blood that it would normally receive. And so therefore, we can feel dizzy and confused. We can get funny feelings in our head. Our vision can change slightly. We become quite confused and disorientated sometimes. And all of this is going on because the fear response is kicking in that fight and flight, the threat system response. And so all of these things are something that is normal for us under the right conditions and in the right context and in the right situation. But obviously, having an inoculation, a vaccination for the coronavirus is a good thing. It's not something that is a real threat to us. So hopefully that explains some of what's going on at that particular time. Mostly our fears and phobias we gather them as we experience life and grow up. And in the majority of cases, if we do develop some kind of a fear and phobia, it's usually before the age of 10. It can happen afterwards, but the majority of it um, means that it happens before the age of 10. We are only born with two fears, and that is the fear of loud noises and a fear of falling. The rest of those fears we learn along the way. So if we have a parent who is scared of spiders and shows us that as a child, with our childlike mind, which isn't fully developed, we then learn from that adult that this is something to be feared. So then we might grow up with a fear of spiders. When we think about injections, we have inoculations for various things as babies and toddlers and young children, even into our young teens. If we've had a bad experience at that particular time, it might be that we take that with us into our adulthood. When we think about it, our parents are taking us somewhere, and we might, find that, that little scratchy feeling when we have an injection was unpleasant. If we pick up a fear from our parents or the parent that's taking us, then obviously that fear is going to mean that we, tense our muscles, which can have an effect on how we feel the injection. Sometimes we hear other children screaming or crying, or and therefore we have an expectation that the injection is going to hurt. And a lot of it is about the expectation. If our parents are showing us that they are nervous, that they keep repeating that it's not going to hurt, then we almost have that expectation that perhaps it might hurt then. And there is a lot to be said about expectation. We all know, and maybe we've even seen, that sometimes if someone's talking to us and we are waiting to have blood taken or an injection or whatever, and they're going, okay, so all it's going to be is this, you're not going to feel anything, and I'm going to count to 3, and then we'll do the injection, or we'll take the bloods, etc. In actual fact, they've already done it before they even start counting to 3. And because we are not expecting that, because we are not expecting to feel the pain, actually we don't, because they've already done it before they even count to 3. So this shows us that expectation has a big place to play in what it is that happens when we go for an injection of any kind. So one of the things that shows us is that if we are expecting something, it means that our imagination is showing us that we can imagine things to have a very negative effect and outcome, or we can imagine them to have a very good outcome. And those of us that are very good at imagining how much it's going to hurt and how awful it's going to be, it just shows us, and especially if that then causes us anxiety, it shows what a very, very good imagination that we have. Now, if we can use our imagination that way, then we can definitely use it to good effects. So one of the things that we can do is imagine having our injection with no pain and no effect whatsoever. And our brain doesn't necessarily know the difference between real life and what we imagine. The very fact that what we imagine can cause us anxiety and all those feelings that go along with it shows us that it's the evidence that that is the case. And it's why a lot of sports people are given coaching, and they are asked to visualize. Let's say a footballer, they're asked to visualize putting the ball in the goal for a penalty shot, and they're asked to do that over and over and over again, and it's like goal rehearsal, so to speak. And they will, when they get to take that penalty goal, it's as if the mind and body has already done it so many times that they just are able to take that shot. And it's the same with us when we rehearse in our heads speeches that we want to make, things that we want to say to people. The more that we do that, the more that we almost feel as though we've done it several times, and it makes us more relaxed around it and more confident in the fact that we can do it. So that kind of rehearsal is quite good. Some of the ways that we can help with needle phobias is to prepare. And if we know that this is something that is a problem for us, then we might want to have some counselling beforehand. We might want to have some cognitive behavioural therapy that looks at how we can change our thinking around having injections of any kind, and look at ways of desensitizing, which means that we might look at a fear ladder and look at, right, well, when we look at our fears and we put them in an order, what's the least frightening? Is that reading about injections? Is it hearing someone talk about injections? Could we move on to looking at photos of people having injections? Could we then be prepared to have an injection of our own? And there's many steps in between. That's just a very shortened version, but that would happen over a number of weeks. Hypnotherapy can be very helpful for needle phobia, and using lots of calming techniques for when we are actually about to have our injection. Strategies and coping strategies that most counsellors will be able to teach you to reduce the stress levels, so that we're moving towards having that injection, and learning how to keep ourselves quite calm before the event, but also some strategies that might be useful at the time, calming breathing, distraction strategies that can be useful at that point. And so other than that, and I could go on, because there are various other ways for counsellors to help with needle phobia, but when we think about practical things, then if you know that it's a difficult situation for you, then it's about planning. And if you know that you're somebody that has fainted before, and that might be a worry, then it's about asking whether you'd be able to have your injection lying down, because obviously that's all about blood pressure. So therefore, if we have the injection lying down, we're less likely to faint, and so it's hopefully going to be a more successful outcome. And you know, there are many activities that you can do whilst you're having the injection, like wiggling your toes. You know, those are distraction techniques. But you know, it's all about, if this is what you know is a difficulty, then seek that help beforehand. A lot of the time, what may happen is that people who are needle phobic will avoid going to have injections, and at the moment that's possibly something that they might want to look into, because you know it can have a knock-on effect whereby we're not looking after ourselves, we're not taking care of ourselves, we don't go to the dentist in case we need to have an injection for a filling or a tooth being taken out, we don't go to the doctors in case they say that we need a blood test, you know. So the avoidance can lead to you know, huge health problems if we're not aware of this, and perhaps it's something that we might want to look into. I hope that that's been of help, but of course, you know, you can of course contact me. I have my email, which is michellemouldImpact@gmail.com, or you can find me as MS Impact on YouTube, and you can respond to this YouTube video and make a comment, or you can phone me on 07977178685, or leave a message, or anyway, there are many ways to contact me, so please do that if you have further questions and this is something that's bothering you, and I might be able to help. So thank you for listening, and hopefully we'll get back to part 2 of grief and loss next time. All right then, take care everyone.